Hello juniors, so I welcome you all again in the continued series of lower limb, and today we'll be discussing an important topic which is the femoral triangle. So in today's video we'll be covering its introduction, boundaries, contents and clinical relevance of this topic. So without wasting any further time, let's move ahead. Starting with the introduction of the topic. So femoral triangle is a triangular region with a wedge shaped area. So this is a wedge shape. So this triangular region is wedge shaped, and the triangle is formed by a depression between the muscles of the thigh. So for your orientation, this is a animation. So the triangle is formed in between the muscles of the thigh. These are the muscles of the thigh, and this is the triangular depression which is formed in between the muscles of the thigh. The triangle is located on the medial aspect of the proximal thigh. So this triangle is located in the proximal region and in the medial region of the thigh. So this is another diagram to just for your orientation. This is a section of the leg where we have taken out the skin and superficial fascia to show you these muscles and triangular depression. So this is our first, second and third muscle, and in between these muscles is a triangular depression which we are regarding as the femoral triangle. I hope you are able to appreciate. Coming to the boundaries and contents of the femoral triangle. So this is the schematic diagram to show you just for your better understanding. This is the triangle. So the superior border is formed by the inguinal ligament. So this is the inguinal ligament which connects the anterior superior iliac spine to the pubis tubercle right here. The medial border of the triangle is formed by the lateral border of adductor longus muscle. So this is the adductor longus muscle. Its lateral border forms the medial border of triangle. Hope you are able to understand that the lateral border of adductor longus, this is the lateral border of adductor longus. This forms the medial border of the triangle. The lateral border is formed by the medial border of sartorius muscle. So this is our long muscle, sartorius muscle, and its medial border corresponds to the lateral border of the femoral triangle. Hope you are able to understand. This is a bit tricky. Since this is a triangle, it would have a base and an apex. This is the apex, this is the base of a triangle. So apex is formed by intersection of medial and lateral borders. So right here is the apex, which is formed by intersection of lateral and medial border. The floor of the triangle is formed by the pectineus muscle and iliacus muscle. So this is the floor of the triangle. The floor of the triangle is made laterally by iliacus muscle. This is our iliacus muscle. This floor is lying beneath the contents of this triangle. We will be covering the contents just in a few minutes. So this floor is lying beneath the contents of femoral triangle, and laterally this floor is formed by iliacus muscle, and medially this is formed by pectineus muscle. Hope you are able to appreciate, and there is nothing to understand in this topic. You have to just visualize this and revise this over and over again and again to fit this in your mind. So the roof, so by the roof we mean to say how deep we have to drill down from the skin to reach this femoral triangle. So if this was the wedge shaped triangle, our femoral triangle, how deep we have to go from the skin. So suppose this is the skin, how deep we have to go from the skin to reach this triangle. So the roof is formed by skin, and deeper to the skin is our superficial fascia, and deeper to the fascia is our deep fascia. So suppose this is our skin, this is a superficial fascia, and deep fascia. If we pierce down till the deep fascia, then we will find this triangle. So this is my very own model of femoral triangle. As you can see, this is a wedge shape which is pointed at the apex and broad at the base. So as we have discussed, the femoral triangle is wedge shaped and its medial border. Suppose this is the medial border. Its medial border is formed by the lateral border of adductor longus muscle. And if this is the lateral border is formed by the medial border of sartorius muscle. The apex is formed by the intersection of both the lateral and medial border, and the base, the top end of the femoral triangle, is formed by the inguinal ligament. Now covering the contents of femoral triangle. So we will be covering contents from lateral to medial direction. So the lateral most content of our femoral triangle is femoral nerve. So right here is this femoral nerve. Now if you have watched my video on femoral sheath, then now it will be super duper easy for you to remember this. The rest of the contents are the contents of femoral sheath. As this is the sheath right here, this is the femoral sheath, as I've already covered on my topic on femoral sheath. The contents here lying in the femoral sheath also lies in the triangle, that is the femoral triangle. So femoral branch of genitofemoral nerve, which lies next to the femoral artery. The femoral artery, femoral vein, and the medial most is our femoral canal, which contains the lymphatics. Coming to the clinical relevance. So the femoral triangle is a crucial anatomical landmark due to its important structures that passes through it. So we have already covered the structures. The important structures are femoral nerve, femoral branch of genitofemoral nerve, femoral artery, femoral vein, and femoral canal. Femoral triangle serves as an access point for femoral artery, as femoral artery can be catheterized for diagnostic and therapeutic procedures. Femoral triangle also acts as an access point for femoral nerve. The femoral nerve is blocked for anesthesia purposes. So whenever you are operating and lower limb surgery or any procedures on lower limb, you give anesthesia on the femoral nerve. Lastly, the femoral hernias. A weakness in the femoral canal can lead to development of femoral hernias. I have already discussed the femoral hernia on femoral sheath topic, so do watch that video, as this topic and femoral sheath are correlated to each other to very much extent. So completed with introduction, boundaries, contents, and its clinical relevance. If you found this video helpful, do like it and do share it with your friends. Thank you.